I'm a little aggravated right now, and I just did a video the other week about how as a nurse practitioner you can still work as an RN, as an agency nurse, however you want to do it, as long as the company and you both agree on the responsibilities. The issue is has more to do with protecting your license, and I've been doing this long enough to kind of know what to do, but I'm more aggravated about the new nurses who are taking these positions and not understanding what these companies' predicaments they're putting them in. So I went to take a shift last night. I was scheduled. I've been in this building numerous of times. I've worked in this building, so I know this building very well. However, they got this new thing where they're wanting one nurse on the floor between 7 and 11 or 7 to 7, which is really awkward because in the morning we have a 9 o'clock med pass. This is nursing home, so if you're not nursing home, it may be different. But in the morning we have a 9 o'clock med pass, which is 2 nurses on these carts. At night, at 9 o'clock, we also, I know as a provider, schedule these 2 times a day, so it's going to be 9 and 9, which is a heavy med pass, right? Not only is it a heavy med pass for the nurse, we supposed to be giving medications an hour before and an hour after. So technically, one nurse would be giving medicines over a time period of 4 hours, which would not meet the requirements of an hour before and an hour after, which also puts the patient into a predicament where labs could be off or medication would not be used properly because we're supposed to be receiving it within the same time frame. So to be honest with you, I've taken the shift. I wanted to see how it was. And after doing the shift, I'm like, okay, this is not safe. I don't feel comfortable. I'm not going to do it. So I was told I was supposed to be somewhere else. I got there and I was not there. So in the moment, I didn't accept my shift or anything. I contacted the young lady and said, hey, this is not safe. I won't be able to accept these keys because it's not safe. So she asked me to go to the other floor, and I said, that floor is not safe either for one nurse. We need 2. So I didn't accept my assignment, so therefore it wouldn't be neglect. If I were to accept the keys and count it off with the nurse, then that would be on me. But to let them know before accepting my shift, this is not safe. So I notified them, and I notified the agency that I work for. At that time, I was notified if they was to find someone, then they would update me. So therefore, I didn't accept and I went home. It was a lot of confusion or a lot of calls. And I would say that because I've worked in the building, because I'm familiar with the nurses, some people called me and was like, hey, we wouldn't mind coming to help if you want to do it, which perfectly is fine as long as we take care of the patients. However, what happens when I'm not the nurse? Are we just going to continue to leave these nurses in these predicament trying to give patients to 44 patients and it's just one nurse? So I made the video because I'm telling NPs or I'm letting people know you can do this, an agency is good, but no matter where you go, you have to protect your license, right? This license goes everywhere, and I'm not in the business to losing it or going to court. I've been doing this since before my daughter was born. She's 17. Like, I'm not trying to jeopardize my license for a paycheck. So with that case, I don't know if I will continue to do agency. I don't know how that's going to work because I still have a license and I have boards and everything to protect. I'm just making this video to let nurses know that these companies are not going to protect you. You got to learn how to protect yourself. But if you don't feel safe doing an assignment, then you need to make sure you're not accepting the assignment and you're not signing off. If I was have to accept that assignment, sign those keys, and then left, then they could have gotten me for neglect. But I also met an agency nurse in transition. She had only been doing agency for 1 year and only been a nurse for 1 year. So a lot of that to me is like, okay, I'm not doing it, and I have met way more years. So to put someone in that predicament is very, is unacceptable and it's not safe. But I also just saw a Facebook post with somebody else complaining about the same thing. But a nurse said to me, they will continue to do it as long as we accept. So I did not accept. Yes, I could use extra money. I have a project I'm working on. I need it, but I'm not willing to lose my license for it. So just be careful when you take this job and just know I need a job, but I may not need that job.